Hey, what's up guys? Today we're going to be talking about the anatomic planes. So these are very important to know about biomechanics, CT scanning, and everything else, and the motion and movement of muscles. So our first one is going to be sagittal. Keep in mind, look at the two T's. I'm going to use that as a memory tool. And it could also be called longitudinal. So with those two T's I was talking about, remember right and left, it's going to split the body in right and left halves, okay? And we could also use parasagittal, which is the halfway mark in between both segments, okay? And the motion in the sagittal plane is flexing or extending. All motions of each plane are perpendicular to that plane itself. All right, our next one's going to be transverse, or it's also called axial. Look at the axe. That's going to be used as our memory tool to remember an axe. And usually when we think of axe as something cutting someone else or some object, it's cutting it in half. So axial or transverse will be cutting the body into the plane that separates the upper and lower halves of the body. So it's in half. Once again, axial or transverse is cutting in half. And what kind of motion would be found in that kind of plane? So let's think about it. So in that plane, we're going to be rotating, right? Because we're going to be going in the same perpendicular motion as the plane. So rotating. So it's either externally or internally rotating. Our next one is coronal or frontal. We're going to go to we're going to change up kind of our diagram. Coronal or frontal is going to be split, and it's the frontal or anterior and posterior halves of the body. So it's front and back. So coronal or frontal. Keep in mind, all these interchangeable words for the planes can be used on tests, so you have to know both. And then the motion in that plane is adduct or abduct. So why do we have to learn about these things? It's to describe the motion in the planes from each muscle or joint. CT scans are in one plane, so you have to order usually a transverse or axial plane versus a frontal plane, and biomechanics. Keep on studying, guys. If you have any questions, leave them below, and please subscribe. Thanks.